Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Staff Nurse Previous Year Question Paper, Part 3. Let's start. The first question: a patient in the ward suffered sudden cardiac arrest. Which method of intubation should be used in the patient? Option A: jaw thrust method. Option B: head tilt, chin lift method. Option C: Valsalva maneuver. Option D: Heimlich maneuver. The correct option is option B, head tilt, chin lift method. A child is on chemotherapy. The nurse should teach the mother about the following except option A, hand washing. Option B, avoid crowded place. Option C, brush 2 times. Option C, sitz bath. The correct option is option D, sitz bath. Furosemide injection is administered to a patient for which action? Option A loop, diuretic to prevent excessive fluid volume. Option B, acts as ACE inhibitor. Option C, prevents gastric movement. Option D, is a thiazide diuretic. The correct option is option A loop, diuretic to prevent excessive fluid volume. A RTA patient came to the emergency room. By which method should the oxygen be administered in this patient? Option A, simple mask. Option B, rebreather mask. Option C, nasal cannula. Option D, non-rebreather mask. The correct option is option A, simple mask. In a 20% burnt patient, how should we check the fluid volume? Option A, weight. Option B, skin integrity. Option C, strict intake output. Option D, height. The correct option is option C, strict intake output. Which behavior therapy should be given to a patient suffering from leg pain and stiffness? Option A, hyponesis. Option B, relaxation. Option C, meditation. Option D, none of the above. The correct option is option B, relaxation. Hypokalemia is seen in option A, burn. Option B, increased uric acid. Option C, Addison's disease. Option D, nasogastric suction. The correct option is option D, nasogastric suction. After blood transfusion, sign and symptoms of circulatory overload is option A, tachycardia, trachypnea, jugular vein distension. Option B, bradycardia, hypertension, fever. Option C, bradycardia, hypotension, fever. Option D, trachycardia, fever, hypotension. The correct option is option A, tachycardia, trachypnea, jugular vein distension. A nurse uses DPT vaccine and found that vial has granules. What is the next nursing action? Option A, discard the vial. Option B, shake vigorously. Option C, check after 15 minutes. Option D, keep using the vial. The correct option is option A, discard the vial. A patient admitted in hospital and suffering from pain, stiffness and fever for 3 days. He is confirmed with HAI. When should a nurse tell the patient about HAI? Option A, on admission. Option B, after 1 day. Option C, after 2 days. Option D, at discharge. The correct option is option C, after 2 days. A female came to the hospital with a breast nodule of size 2 semi, which is freely movable, palpable but no nipple discharge, is seen from the breast. What is the best investigation for this condition? Option A, FNAC. Option B, core needle biopsy. Option C, breast USG. Option D, mammography. The correct option is option D, mammography. A patient in the post-OP area after having a right side mastectomy, what should be the priority care for the patient. Option A, take BP from right side. Option B, take BP from left side. Option C, attach pulse oximetry on left side. Option D, attach pulse oximetry on right side. The correct option is option B, take BP from left side. EMLA, a topic anesthetic, should be applied for how much time before the procedure? Option A, 10 minutes. Option B, 30 minutes. Option C, 60 minutes. Option D, immediately before procedure. The correct option is option C, 60 minutes. Suppose you are a nurse on duty and you are asked to measure the BP on an adult. While choosing the cuff, the correct ratio of bladder in length and width is option A, 1:3, option B, 2:1, option C, 1:2, option D, 3:1. The correct option is option B, 2:1. Small syringe size of first use of central venous access device is option A, 5 ml, option B, 1 ml, option C, 2 ml, option D, 10 ml. The correct option is option D, 10 ml. What flow rate should be set when using a resuscitation bag? Option A, 10 liter O2 per minute. Option B, 9 liter O2 per minute. Option C, 15 liter O2 per minute. Option D, 8 liter O2 per minute. The correct option is option C, 15 liter O2 per minute. After taking blood from blood bank, the blood transfusion should be started within option A, 30 minutes, option B, 60 minutes, option C, 90 minutes, option D, no such time limit. The correct option is option A, 30 minutes. Which of the following is the indication to perform suctioning? Option A, normal air entry on auscultation. Option B, the patient has an effective cough. Option C, reduce oxygen saturation levels. Option D, normal respiratory rate. The correct option is option C, reduced oxygen saturation levels. Mother of a 3-year-old child asks the nurse about instruction following the use of a spacer. What will you tell the mother? Option A, mouth rinse after 30 minutes. Option B, keep breathing in spacer for 30 seconds. Option C, deep breaths while using spacer. Option D, time between alternate puffs is 30 seconds. The correct option is option D, time between alternate puffs in 30 seconds. The nurse is attending to a client who was diagnosed with heart failure. During the examination, the nurse observed that the patient is dyspneic with crackles upon auscultation. Which symptoms would manifest for a client with excess fluid volume? Option A, decreased central venous pressure. Option B, flat neck and hand veins. Option C, hypertension. Option D, weight loss. The correct option is option C, hypertension. Please like and subscribe. Thank you.